everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Terazosin. Its brand name is Hytrin. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Terazosin is a selective alpha-1 adrenoreceptor blocker. It blocks alpha-1 adrenoreceptors in the neck of the urinary bladder as well as the prostate gland. This would produce relaxation of smooth muscle in these areas. It can also cause some vasodilation, which will sometimes result in orthostatic hypotension. In terms of indications for use, Terazosin is indicated to be used in the treatment of BPH, or benign prostatic hyperplasia. It can be used in the treatment of high blood pressure, or hypertension, and there's also some off-label uses as well. Now, before an individual was to use Terazosin, there is a contraindication they must clear, which in this case would just be a hypersensitivity to Terazosin or any other component of the product. And there's also some precautions and warnings that they should be made aware of. So in terms of precautions, Terazosin is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would not want to use Terazosin to treat hypertension in the elderly population because of that increased risk of orthostatic hypotension, which could lead to falls in this population. Older women would also be at an increased risk of urinary incontinence if they were to use Terazosin. It's important to notice that carcinoma, or cancer of the prostate, must be ruled out before therapy with Terazosin is initiated. It should be noted that floppy iris syndrome can happen to individuals using Terazosin who have a cataract surgery. Patients should be made aware that syncope and sudden loss of consciousness has occurred during the first dose of Terazosin in some patients. As we mentioned, orthostatic hypotension may occur, so patients should be made aware of this before taking the medication. And lastly, for precautions, rarely priapism has occurred, so patients should just be made aware what to do if priapism was to occur. And once somebody is cleared of that one contraindication and made aware of the precautions and warnings, and they start to use Terazosin, they can expect to receive their dose in capsule form. So when somebody is using Terazosin to treat their BPH, they would typically start off on a dose of 1 milligram once daily near bedtime. It's important with this medication not to exceed 1 milligram just on the initial dose. The dose would then be titrated in a stepwise manner to 2 milligrams, then 5, and then 10 milligrams if needed. We would just increase the dose until we have desired flow rates and improvement of symptoms. The usual maintenance dose is somewhere between 1 and 10 milligrams once daily, and that dose of 10 milligrams is actually pretty often required. It should be noted that some patients, although this would be more rare, do require 20 milligrams daily. If the medication was ever discontinued, or the patient missed their doses for quite some time, they would usually start off back on that initial dose of 1 milligrams and then titrate back up to their maintenance dose. When a patient is using Terazosin for hypertension, they would use that same initial dose, which is 1 milligram once daily near bedtime, and then the dose would slowly be titrated upward once again. However, in this case, the maintenance dose usually falls between 1 and 5 milligrams daily. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Terazosin, so I'll go over some of those here now. 1 to 7% of patients do experience that orthostatic hypotension, which for those who don't know is just a drop in blood pressure when going from a seated to a standing position. 1 to 4% notice heart palpitations. Peripheral edema may occur in up to 5.5% of patients. Around 2 to 4.5% may experience nausea. Dizziness can happen between 10 and 26% of the time. And headache generally falls between 5 and 16%. Somnolence has been reported in between 3.6 and 5.4% of patients. And nasal congestion can happen up to 12% of the time. Now, some more rare but serious side effects would be syncope, which generally happens less than 1% of the time. That intraoperative floppy iris syndrome that we mentioned that can happen to patients during cataract surgery. And lastly, priapism. That's all we're going to talk about today with Terazosin or Hytrin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. This is it for today. Take care.